Hello and welcome to India Top Doctor. Today we will talk about cardiac rehab post bypass and angioplasty. And for that, we would like to invite Dr. Mitshu Doshi. She is a specialist in cardiothoracic. She has been practicing for 14 years. She sees patients with heart disease, high blood pressure, and diabetes. She's the director of the Mobility Clinic. The Mobility Clinic is one of the revolutionary clinics serving exceptional customer or patient services. It has a unique concept in the physiotherapy field like cardiac rehabilitation and podiatry as its basis of services. So let's welcome her. Welcome to India Top Doctor. As you know, today we'll be talking about cardiac rehab, post-bypass and angioplasty. But before we move ahead, can you tell us what is angioplasty?
Hi. So, angioplasty. So, basically, we all know that our arteries go under blockages. Okay, there are clots which get developed, and that is why our arteries get narrowed. Because of which certain procedure is required to remove those clots or to get logged off these clots. So, there is this procedure which we call as angioplasty. What happens is a surgeon makes a small incision in your groin or in your arms, and there is a catheter like a tube which is getting passed from that directed towards the heart. Okay, once it is directed towards the heart, they on the tip of it there is a balloon which they inflated, and they get off the flow of the clot which is present over there, which allows the blood flow to pass through the arteries. So this procedure is also done with the small mesh-like wire, which we call as a stent, which is placed in the arteries. So the clot is removed, it gets logged off, displaces off, and the blood flow can pass. This is a non-invasive surgical procedure. It's not like a bypass surgery where you have an open chest. It's a normal routine procedure surgery which can be done. But I would say that angioplasty is very good to improve symptoms of the blocked arteries, such as your chest pain, your shortness of breath, etc. The surgeon decides whether you can go for an angioplasty or a bypass surgery.
All right. So what all things should be avoided during angioplasty?
As you know, angioplasty is done because there is a block in the artery. So once the angioplasty is going to get done, or when the angioplasty is done, okay. So there are things you have to first is maintain the healthy heart. It's not like that, okay, my stent is done, so my work is done. You can't just behave like that, okay. So a patient has to be really maintain a healthy lifestyle, which is very important for a healthy heart. He should not say example, if a patient is on a smoking, so he should quit smoking, which is very important for the angioplasty. You have to lower your cholesterol levels. Say if you have diabetes, you have blood pressure, you have to maintain them at normal. That is the biggest key factor for it. Also, diet should be followed properly, and that should be low in saturated fat. How much portion of food you are eating, adhering to restriction of the proportion which is given during the angioplasty via your dietitian. You should be maintaining that adherence of portion of food, and it should be low in saturated fat, which is the main key role playing in the angioplasty recovery. Maintaining weight, if you're obese, maintaining a healthy weight is also very important. There's one article also which says that when the angioplasty was done for a patient with a chest pain, smokers who quit smoking during the angioplasty procedures after that, okay, they had a healthy recovery as compared to a non-smoker. So quitting smoking is very important part of the angioplasty.
All right. And is there any danger with angioplasty? Is there any consequences of that?
Well, when angioplasty is done, ideally complications at times do have with the surgeries, but not a likely one. But you can see is there can be a re-narrowing of the arteries again. That could be one danger. Also, at times clots developed in the arteries when the stent is placed. That is also one of the danger. And very lastly is when the catheter is put for the angioplasty procedure, there could be a mild bleeding which can occur in the organs or something like that, but which is taken care by the surgeon well. So these are the dangers ideally we see, but they are well controllable as well. Yeah.
Okay. And can you tell our audience about the phases of cardiac rehabilitation?
So before we go to the phases of cardiac rehabilitation, I would like to tell that what is cardiac rehabilitation. Okay. So cardiac rehabilitation is a part of an exercise program which is done your post surgeries. So whether you do a bypass surgery or a valve replacement surgery or an angioplasty, stent is fitted in your body, you don't know how to get back resume to work. Okay, that is what cardiac rehab is. So say for example, if somebody would say before it was possible that the cardiac heart attacks was after 50s and after 60 years of age, but now it has become very common at early age also. We see a lot of patients with 30 years and 40 years also having issues with the heart. Okay, so post surgery, they would definitely not retire their life. They would like to go back and resume their activities and work. So they always have this question in mind that how should I resume to activity? When should I start lifting weight? When should I start driving? When I can resume to my sports activity? So all these summation of activities, what is taught is your cardiac rehabilitation. Okay. So cardiac rehabilitation includes your medical screening, your proper exercises, your diet counseling, your vocational counseling, your how to prevent future complications, and most importantly, rebuild your life both physically and emotionally. So we divide these exercises into four phases of cardiac rehab. The phase one starts when the patient is in the hospital after the surgery. This stage is your medical evaluation, your risk factor management. What is your risk factors? Say you have diabetes, you have cholesterol, you have etc. Those risk factors, how are you going to manage them? How do you start mobilizing yourself once the surgery is done? Until the discharge planning is your phase one. Ideally begins with non-strenuous activity like sitting up on the bed, range of motion exercises, self-care you can do, how you can just go to the washroom, how can you start doing your self-care activities. Ideally, 40 to 60% of maximal functional capacity we treat at this level. This phase is till the time the patient is in the hospital. Then we have the phase two. Phase two focuses on an exercise part now and risk factor modification programs. So the patient undergoes exercise training in a cardiac rehab setup with a certified cardiac rehab therapist. And whatever exercise they are doing it is done with their ECG monitoring. So what all exercises you do, your ECG monitoring is going on along with your exercises. You are well educated about the cardiovascular risk factors and your lifestyle modification changes what a patient requires as per their issues. Frequency of exercises 3 to 4 sessions per week, depending on the improvement of 12 weeks. And ideally, we take 5 meds, that is metabolic equivalents or less, for this phase two. And 50 to 85% of maximal functional capacity is taken at the level of phase three. So phase four is your lifetime maintenance phase. Okay. This is like a long-term commitment of yourself with the exercises where you can resume all your activities, go back to the sports what they want to resume. So this is just not that cardiac rehab is done for certain phase three and now I'm fine, so I should stop exercising. So this phase is most important because it's a commitment of yourself of exercises with for the lifetime. So phase four completes your whole cardiac rehabilitation program. Yeah.
All right. So as you mentioned about the lifestyle modification and exercises one should do, can you tell some of the ideal modification or exercises that one should do in cardiac rehab?
Surely. So In cardiac rehab, already we know that all of the having a different type of artery and blockages and different type of surgeries, maybe sometimes a valve, sometimes a bypass, sometimes angioplasty. So there are certain guidelines which are followed by us, which is like American Heart Association guidelines and ACSM guidelines. So these guidelines are followed for giving a FITT principle. Now, what is FITT principle in exercise is frequency, F, I for intensity, T for time, and T for type. So how much frequency you should be doing, how much time you should be given to exercises, how much intensity you can give, and what type of exercises you can do. You can't just, there are people who will say, okay, I start with cardio. So they don't know how much to work, how much the heart rate should go up, how much they should be doing after the surgery. So ideally, a cardiac person post surgery can resume to aerobic training, your cardio training, your weight training, your resistance training, depending on the protocol which is prescribed by the cardiac rehab therapist. So you can start with cardiac exercises like walking. You can start with cycling. You can spot jogging. Again, I would say that after prescribing an exercise prescription from the therapist, you can also do the resistance and weight training, but not immediately. Gradually, they can progress to it. Sticking to the intensity protocols, say around starts with 40% of heart rate reserve to say around they can go to 60 to 70% of heart rate reserve gradually once they are start being trained along with the ECG monitoring. So all these type of exercise they can do. Only thing is progress slowly. That is more important. Some people having low ejection fraction, if the pumping of the heart is a little low, then the exercises are performed in different manner. So weight management, weight lifting, and all those activities are reduced for them. So depending on the condition of what they have, as per that we can start exercises for them.
All right, we had so many knowledge. We gained so many knowledge today. I'm sure the audience gained and learned about something new. In the end, can you share any message with our audience now?
Okay, surely for sure. So, according to, I would just say that according to the global burden of disease these days, a quarter of the deaths, that is say around 24.8% deaths in India are happening because of cardiovascular disease. Okay. So I would tell people a message that you should be doing cardiac rehab programs. Not only you've undergone a surgery, this is just not the treatment, it is also a preventive program also. Say now if you have got a blood pressure or a diabetes or a you can say some cholesterol, which are all the risk factors to get a blockages. So you can start exercising and do a lifestyle modification changes at that particular time, so you do not reach to the level of the blockages. Okay, so if you have these risk factors, say your family person, so your mother or a father or a brother has a family history of heart issues, and you have just got the risk factors of diabetes or BP, start doing cardiac rehab from a certified cardiac rehab therapist programs. Exercise can work as a prevention, just not only for treatment, but even you can prevent. As we all know, prevention is better than cure. So I would always give my message to all the people, just if you find any risk factors, start doing cardiac rehab programs before you reach to the level where you have to go for an heart issue. Yeah.
Thank you so much, ma'am. Very well said. Absolutely. Thank you so much for being here with us today.